Cranial nerve 11, the accessory nerve. The accessory nerve originates in the spinal accessory nucleus of the upper cervical vertebrae. It travels upward through the foramen magnum. It exits out of the jugular foramen. It has two branches, the internal and external. The internal is composed of fibers of the cranial part. The external is fibers that innervate the sternocleidomastoid and the trapezius, receiving innervations from C1 through C4. The external branch has a close relationship with the jugular vein. The nerve rests on the vertebral artery. It is involved by denticulate ligament before exiting the foramen. In the inferior aspect of the cranium picture, you can see the foramen magnum and the jugular foramen, which is where the cranial nerve 11 exits from.
The function of cranial nerve 11. Cranial nerve 11 is a motor nerve. It innervates the trapezius and the sternocleidomastoid muscle, which makes it essential for movement of the neck and the shoulders. So the sternocleidomastoid and the trapezius muscles have the following functions: rotation of head away from side of the contracting sternocleidomastoid muscle, tilting the head toward the contracting sternocleidomastoid muscle, flexion of the neck by both sternocleidomastoid muscles, elevation of the shoulder by the trapezius, and drawing the head back so the face is upward by the trapezius muscle. It also works in conjunction with the vagus nerve to innervate the muscles of the larynx, the palatal, pharyngeal, and laryngeal. Okay. And then I guess I have clinical presentations of pathology.
Yeah, you can, or I can, doesn't matter to me.
It doesn't matter. What do I have? Because there was one, I wanted to say something about this picture. Clinical presentation of pathology. If weakness or damage occurs to the nerve, there will be apparent decrease in function or paralysis of one or both the trapezius and the sternocleidomastoid. The weakness or paralysis in either or both depends on where the lesion or damage has occurred. Symptoms range from weakness, uneven shoulders, or scapular winging may occur. On that first picture on the left, you can see a symptom of accessory nerve palsy. The right trapezius and the sternocleidomastoid muscle were wasting, and these changes led to the deepening of the supraclavicular fossa. As you move to the center picture, you can see a gradual decrease in aneurysmal size completely eliminates the symptoms. And that last picture on the right, you can see that left shoulder has dropped, the trapezius has dropped, and you can see that scapular winging.
The 11th cranial nerve can be affected by ALS, syringomyelia, polio, and intraspinal tumors. The clinical testing for the accessory nerve can be done by two different tests. The first test involves testing the sternocleidomastoid. The second test involves testing the trapezius. In the next slide, you will see us test both of them.
So there's two tests to test the accessory nerve. So it innervates two different muscles, the sternocleidomastoid muscles and the trapezius muscles. So the first test that we're going to be doing is to test the sternocleidomastoid muscles. So what we're going to be doing is I'm going to come over here to Leah. Leah is going to turn her head against the force of my hand. So we're turning to the left. So we're testing the right accessory nerve. And if I have her turn her head to the left, or to the right, we're testing the left sternocleidomastoid muscle, so testing the right accessory nerve. And then we're going to do the trapezius muscle. So to test the nerve innervation for the trapezius muscles, Leah's going to shrug her shoulders up, and then she's going to try and keep her shoulders there while I push down. Good. And that's it.